So I wanted to post this video to explain to the general public, as oftentimes patients are confused about exactly what we're capable of doing as pathologists. So I wanted to post this video to show patients as I consider completely changing my practice over to house call and mobile medicine. But I wanted to show this video to show you that in general, uh, we don't need a lot of tissue to make diagnosis. And so while I have this on, I'm just going to scan around first just to show you that this is the biopsy that I took from the tongue. And from start to finish, let me see if I could go to a lower power just to kind of show you the size of this biopsy. And it was just a small 3 to 4 millimeter biopsy. You can see I got skeletal muscle right there in the deep part of it. So it was a very adequate biopsy to make a diagnosis. You know, on the tongue, the anterior part of the tongue has normally fungiform and filiform mucosa. So some of this is probably representing normal tongue mucosa, but as we go around, just to show you, that's abnormal. That's a papillomatous sort of proliferation on the tongue. And I'll tell you what all that means, but this part right here is probably relatively normal, and then we'll go and view more about it. And this part over here even is probably relatively normal, but this part here to show you that's abnormal. That's a papillomatous sort of proliferation on the tongue, and I'll tell you what all that means. But this part right here is probably relatively normal, and then we'll go and view more about it. And this part over here even is probably relatively normal. But this part here is probably some sort of warty or papillomatous proliferation of the squamous epithelium. And as we go down, you can see that while there is essentially maturation in general of the squamous epithelial cells, you can see from the base, here's the base of the epithelium, and with nice, there's some inflammatory cells there in the base, and we'll further evaluate that. But if you look you start seeing these like spaces in the cells, clearing of the cells, and more, and in some cells, you're going to start seeing some binucleation. Normally, you can have some keratosis on the surface of the tongue. That's okay, but and in some cells, you're going to start seeing some binucleation. Normally, you can have some keratosis on the surface of the tongue. That's okay, but I think this is abnormal keratosis in addition to what you would normally see on the tongue. But I wanted to also highlight, before I go and show you the inflammatory component, I wanted to highlight that you see every now and then you see these cells that look like they may be binucleated. Let me see if I, like in here, that's abnormal. Those are almost like corticocytic looking cells, and there is a nicer one right there in the middle. So I started beginning to entertain the possibility, could this be like a little small papillomatous, maybe a wart, HPV-like a wart? And so what I recommend to the patient is that the person will get a pap smear done just to make sure there is no warty change in the cervix as well, cervical vaginal tissue. And then if you look down closer as we go down to the base, we're going to start seeing there is no warty change in the cervix as well, cervical vaginal tissue. And then if you look down closer as we go down to the base, we're going to start seeing there's slight proliferation, hyperplastic proliferation, still not quite in the differential of high-grade displayed nodal malignancy by any stretch. But you can, and also you can see some inflammatory changes. And when you see that, you start thinking, is there an infectious component, or is this lesion turning on itself or becoming necrotic? But there's some acute inflammatory cells. And when you see that in the epithelium, you want to do what we call a fungal stain. So I'm going to show you the fungal control first. So here's the control as we go down just to see if the stain worked properly. We're going to look at to see if we see some fungal. This will be a positive control. And as you can see, as I go down in there, you're going to see an adequate control. And that's one of the things that are required when you do a special stain. Make sure you stain a positive tissue just to show what you're staining for. So this is positive control staining for yeast. And so now I can go to the tissue itself, the patient sample. As I get it back in focus, bear with me. So now we're in the patient sample. And I'm going to go down to a closer view so we can look at the surface, because we're looking for surface fungal elements. And you can see that the surface is very clean and there is no evidence of a positive staining of fungal elements. So this would be a negative PAS fungal stain for fungal elements, okay? As we continue around, that's just trash there. It's not, and you have to look for the morphology, not just the color of the stain, but also it has to be fungal element morphology. And so we don't see none of that in that. So this person, I'm concerned, may have a HPV-like lesion on the tongue, and we're going to refer her for colposcopy. I'm actually a pap smear, and then correlate with also ear, nose, and throat doctor to do a further evaluation. That concludes the dictation.